Yeah, so remdesivir was developed as an antiviral to treat a number of viral infections. We know that, at least in vitro, we have activity against some other coronaviruses, MERS and SARS. And so we hope that it has activity against this coronavirus as well, the new one. Yeah, there are 2 trials ongoing in China with an investigator in China at the China-Japan Friendship Hospital. One study is in patients with more severe illness and another in patients with milder disease. We'll be looking at those data. The investigator will be getting those data in roughly a month or so, maybe a little bit longer than that, looking to see if patients get better after treatment. Yeah, we're working really hard. As you can imagine, this is an investigational agent. That's really important to emphasize. We hope that it works, but we don't know yet whether it works. If it works, we will, of course, try to make the drug available as widely as possible. We're working as hard as we can right now. We have people around the globe working 24 hours a day to make as much remdesivir as we can in the hopes that the drug works and to make it available as quickly as we can. Yeah, it really falls into 2 categories. The first is to make sure that we determine that the drug works. So in addition to the trials I mentioned in China, trying to do as many randomized trials or generate the data to make sure that the drug is safe and effective. The second is to manufacture as much drug as we can at risk to ensure that we can supply it to patients if it becomes necessary. And again, we have manufacturing going on around the world, and we are looking at every possibility we can to expand that manufacturing to get as much drug made as quickly as possible.